Let's see. For the group, do you want to talk? Do you mind, or for my education, would tell us a little bit about your experience with the lap band again? Just kind of.
You know, when I first received the lap band, I wanted to do the less invasive procedure that I could, the least invasive procedure that I could, because I'm not into mutilation. Way to go too, and I wanted something, you know, that could be reversed
Right.
or adjusted.
Right.
You know, I actually never had it filled because, like I say, about 9 months out, I started having this tightness and things getting stuck, and I thought, my gosh, if it's that way now,
If you filled it, it would just be.
it would be worse. I'm thinking, okay, everything is going to just stick and not go down, you know. For nausea or anything like that, no.
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 Just a
you know,
feeling of tightness, and it wouldn't go through.
Right. I mean, sometimes I feel like when I bend over that the band is around my neck almost. You know, it's that feeling that there's just a tightness
Right.
all the way up, you know, and I know it's not. But
And you've had the band for how long?
July 9th of 2004.
Okay.
You know. But, you know, sometimes even water will get stuck.
Right.
It all depends. It's harder to eat in the morning and at noon than it is to eat at night. By night, things seem more relaxed or something, and it's
Okay.
easier to eat at night. In the morning right away, I don't usually want to eat in the morning. You know, I don't feel hungry, things like that.
And your surgeon was in Michigan?
Yes, in Port Huron.
And pretty nice guy.
Very nice guy. I mean,
So-
nice people.
So
you know.
again, some people get the idea that if you get a bad surgery, that, you know, there's some kind of
No, I
bad
don't
guy.
think anything is
Yeah,
wrong with the surgery.
he
It's
was
just
not good for you.
It's not working for me.
Right.
And obviously then I had to have reconstructive surgery on my foot, so I was in a cast for 3 months.
But let me
Laid
ask you this:
out.
when you probably then went back to your doctor and described these symptoms.
I went to my gastroenterologist who was local because
Right.
my doctor's like 3 hours away where I had the surgery.
Right.
So I went to my local doctor, and he first stretched my esophagus. I went through that process. And I said, it's still not any better. Things are getting stuck, you know. So he sent me for a barium swallow.
Right.
And so I had that and went back to see him. And he said, you just have a slow esophagus and there's nothing I can do for you. And I said, well, you know, I have the lap band. He didn't think it was from that, but he had had no experience with a lap band either, you know. So
Right.
he didn't think it was from that. So I just thought, okay, this is something I just have to live with. You know, he must know what he's talking about then, if he doesn't think it's from the band. And then I think, well, then I started gaining some weight because I was eating things that went down easier.
Well, now
You know?
let's talk about that. One of the things that we've heard is that people will have trouble with their band. They'll try and eat things, and like celery, apples, meat, that's going to be tough to go down.
Yes.
Whereas
Yes.
like a chocolate milkshake.
Well, go down easy, except I'm lactose intolerant, so I can't do
Okay,
that.
so but what
Yeah.
what the band does then in some people is it kind of teaches you against your desires, against your will, that kind of junky foods go down pretty well. So potato
Right.
chips.
Oh, anything dry. You know, you'd think popcorn would be the worst thing you could possibly eat. I can eat a whole bag of microwave popcorn. Goes down just fine.
Right.
No problem at all. I try a little piece of meat, piece
Yep.
of chicken,
Yep.
sticks right there.
Right.
You know, and I'm like, this makes no sense whatsoever.
Now, what we hope is that your gastroenterologist is pretty wrong. We're hoping
I
that.
hope so too.
Because there are people who have esophageal problems and
Well-
trouble swallowing.
See, my mother had her esophagus stretched many, many times.
Right,
And
so
so
our hope-
I'm a little concerned because I am getting older, and I
Right.
think, okay, maybe he's right. Maybe it's not from the band. You know?
Right. So what we think, though, I think it's probable, is that when we take out the band and its kind of roadblock, that the esophagus will be better able to empty.
It'll
And
relax.
so even though, yeah, exactly. So our hope and expectations are,
Yeah.
is that when we take out that band, we're going to cause this esophageal problem to improve tremendously.
I was going to say, the one thing that I could eat well was salads. Salads went down just fine, you know, and I do eat a lot of salads because of that reason. I don't want to be embarrassed out at a restaurant that something is sticking in my esophagus and not knowing which way it's going to go. You
Where's
know,
the bathroom?
So, right, yeah, where's the bathroom? And
Right.
so,
And
I eat
again,
a lot of
even with all
salads.
this diet modification that the esophagus and or the band has caused for you, you still haven't lost too much weight, or you gained it back?
no, I
or-
gained. I weigh. I started out at 254, prior to the surgery, I lost down to 246 before the surgery. They wanted me to lose a little, and I did. I weigh 262 now. But I have arthritis, osteoarthritis, which with the foot surgery and everything, it took a year before my foot was fully healed after being in a cast for 3 months. And my other foot probably needs a surgery. It's the osteoarthritis that prevents me from being as active as I'd like to be.
Remember,
but I know,
we talked about that yesterday.
But I know the weight
hurts it.
Well, it's like my body is saying, you cannot carry this anymore. It just doesn't want to.
Right. We expect to help with
my
that.
bones hurt.
Right.
My skeleton hurts. It's like it needs to have some relief.
Right. And we expect we'll be able to help with
Thank
that.
you.
So. My favorite patient today, I like all of you, like you like all of your children, but you're my favorite patient because I love taking out lap bands. So
I'm going to love having it out too.
Yeah.
One question: I was told that you will not remove the port at this
right.
time.
Never take out the port.
It hurts.
Sorry.
I can show you where it is. I know right where it is. It hurts. Why not though?
It takes about an hour to dig it out.
Does it really?
Yeah. And so in other words, we can do a whole lap band removal and a mini-gastric bypass in less time to dig out the port.
Okay, that's what I wondered.
And the port was designed to be in there for a lifetime. Wow. And adding an extra hour to your anesthesia is purely silly. Plus, the incision we make to get to the port
has to be larger.
Has to be great big because you're great big. Okay? In other words, in a year, when you're as skinny as that lady we saw from Seattle, to take out your port, I could do it with a pair of tweezers. You make a little cut and just pop it out.
I could do it with a pair of tweezers.
Exactly. Once you become that thin. So we started, when we were inexperienced about taking out lap bands, we do everything, and at the end we take out the port, and it's just murder. Okay. You have to make an incision that's this big, and you cut down, you have big metal retractors like we did in the old time. Then you have pain from the port removal and the big incision, and then we're not sure, is that pain from the port removal or is there something serious going on inside? So go ahead and ask me again to take it out.
Not today, I won't.
No.
Maybe after you've had a glass of wine.
No. We're not taking out the port.
Okay.
Yeah.
All right.
In a year, come back. Or you can go to your doctor's office.
Before, we didn't know why.
Right, they just said he's not going to
now it makes sense.
Okay. Yeah, and we didn't know about it either. I mean, taking out lap bands is becoming one of my favorite things. As I said, I just enjoy it. We really feel we help. And when we started, we tried that. And again, one of the advantages of coming to see me is I've done 4,000 people.
Exactly.
Well, so I know a lot. So for example, there's a lot of good doctors who inject numbing medicine into the ports. In other words, they came up with this idea that, gosh, people are having so little pain from the surgery, maybe we can take away the last bit of pain by injecting numbing medicine to where the ports are. So for a couple of years, I injected lidocaine, Marcaine, numbing medicine into the ports to help cut down on the pain. Okay? And I thought it was working, and then we had a patient who might have had a reaction to the chemical, the Marcaine chemical. And so we stopped it and measured the difference in pain medicine people needed, the pain reports, how long I spent in the operating room, and how long it was till hospital discharge. And once we stopped using the Marcaine, there was no difference in patients' sensation of pain. There was no difference in how much pain medicine they used. They went home from the hospital a couple of hours on average earlier, and the operating time was shortened by 10 minutes.
Well, having had the band, I really don't anticipate this being a lot worse than having the band, so I'm not really concerned, and I'm glad I'm here and that you are the one that's doing it. I was sent here for a reason, and
good. Well, we're glad to have you.
I respect your expertise. And,
sure. Well, I think it lets me talk a little bit about a couple things. One is there are some things that kind of make sense, which is if you're going to be taking out the band, why don't you take out the port? But again, one of the nice things is we do have this kind of huge experience. Now, I think you have to be cautious. I'm not claiming experience in breast cancer. I don't think I'd be a good person to call for that. I know I can tell you, don't call me about stocks or investments, because I have no idea what's going on there. I'm sure of that. But when you ask me about lap bands and removing them and the mini-gastric bypass, there may not be anyone in the entire world who knows more about it than me. So I think that's a good thing for you. But it lets us talk about that, because we've been through lots of these different ideas and thoughts. And I think that that long experience gives us the opportunity to give you the best advice about what to do.
And I appreciate it.
Mm-hmm. Yeah.